Hello, everyone, and thank you for joining us on this beautiful Tuesday evening in Indianapolis. My name is Montoya Barker, Special Collections Librarian for the Indianapolis Special Collections Room at the Central Library of the Indianapolis Public Library. Today's topic will focus on Eskenazi Health with Todd Harper, Director of Public Affairs and Communications. Please use the chat throughout the presentation to ask questions or leave comments. We'll answer your questions at the end of the presentation. I'm very pleased to welcome Todd Harper from Eskenazi Health as our speaker. Todd, can you hear me?
Yes, I can.
Everything's ready. You're all set.
Great. Thanks so much, Montoya. Okay, yeah, welcome. I'm going to give a kind of an overview history of Eskenazi Health, Wishard Hospital, City Hospital, all the different names we've had over the years. Our history actually traces back more than 165 years. We're the oldest hospital in the state of Indiana, oldest hospital system in the state of Indiana. We actually began broke ground on then City Hospital in 1855 and opened in 1859. City Hospital, you can see the image there on the screen. This is one of the first images of City Hospital, the area, which was Indiana Avenue and 10th Street, so very close to where Wishard Hospital existed. And our roots trace back to a smallpox epidemic in the 1850s. That was the reason why the hospital was built at the time. If you look back at the history of hospitals, most care was done at homes. Doctors would go to homes, travel to give actually births were at homes, and that continued for much of the early part of the 20th century. And now we can't imagine life without hospitals. But we then transitioned to a military hospital during the Civil War period. And here are some of the early images of then City Hospital. Again, very close to where Wishard Hospital existed. And actually, some of the buildings were built over time. And some of the buildings that included Wishard also were from City Hospital. So. And I'll go throughout the whole timeline of our history and some of the milestones that existed as part of the history of Eskenazi and City Hospital. Then after the Civil War, we saw there was a need for a hospital in Indianapolis, and City Hospital continued. The city took over ownership of the hospital after the Civil War. It had been a federal government run hospital during the Civil War period. And then from 1866 is when the current City Hospital began serving. And so from 1866 onward, we've been basically the hospital for Indianapolis. We started as a 75-bed charity hospital that existed there at Indiana Avenue and 10th Street. Various medical schools also at the time. There wasn't the Indiana University School of Medicine, but medical schools used City Hospital as a training hospital. So teaching has always been a very important part of our hospital. From City to Wishard to Eskenazi, we're closely affiliated with the IU School of Medicine today, and I'll get into that a little bit later in the presentation. But teaching has always been an important aspect of who we are and what we do at Eskenazi. Here you can see this image here shows some of our nurses. So the Flower Mission Training School for nurses, we graduated our first class of 5 in 1885. We also and during those from that period, 1885, all the way until about 1981, there was a nursing school at the hospital. It became the Wishard Nursing School in its later years, with the last class graduating in the early 80s. Over that period of time, nearly 3,000 nurses graduated from the school, and it had a 97-year history. It survived a long time. During the early 80s, there was a lot of transition, and the IU School of Nursing and other nursing schools really were the go-to. So there was not a need for a hospital-based nursing school any longer. And that's the reason why it officially closed. And then here again, a lot of advancements in the 1880s. We saw a lot of development at City Hospital, including the first City Hospital ambulance began carrying sick and injured patients. And actually, our history with ambulances in Indianapolis, we were one of the first to have ambulances. It was not a common thing to have ambulances back in the 1880s. And it basically laid the groundwork for the largest hospital-based ambulance service in the nation. So if you remember the Wishard ambulance service, just about 13 years ago or so, the Wishard ambulance service and the Indianapolis Fire Department's, their ambulance service merged along with some of the township fire EMS services, and it became Indianapolis EMS. So you have the Indianapolis Fire Department and now Indianapolis EMS. So our roots, Indianapolis EMS's roots go back to City Hospital, and actually Eskenazi is still the hospital sponsoring hospital system, the Indianapolis EMS. You'll see Eskenazi on the back of the ambulances. We work very closely with their staff and employees. I work in the public affairs department, the communications department for the hospital, and we provide the EMS communications as well for PR and marketing. And then, as I mentioned, in 1909, that's when we officially began our relationship with the Indiana University School of Medicine. And they began, we have continued that lengthy affiliation with the school ever since. All of the Eskenazi Health physicians are also IU School of Medicine physicians. So they're faculty of the IU School of Medicine, basically like professors. And they are able to teach the med students that come through Eskenazi, how to become a doctor. So a lot of our, we have a lot of med students that go through Eskenazi. Also, the IU School of Medicine has med students that also are at the VA hospital and IU Health Methodist and University Hospital and other surrounding hospitals. But we get a lot of med students through Eskenazi as a teaching hospital, and it provides a great experience for them as they move forward in their careers. And then again here, just showing the emphasis that the School of Medicine is again still very closely aligned with Eskenazi. Our CEO, Dr. Lisa Harris, is actually a dean of the IU School of Medicine. So she has an affiliation not only with Eskenazi, but with the School of Medicine. So she's able to link in with the clinical aspects that the school has. And the School of Medicine today is one of the largest schools of medicine in the country. I think it's the second largest, which is pretty remarkable. This image here shows one of the wards, and would be in the early 1900s at then City Hospital. You can see definitely a very different experience than what you get today. Currently in our hospital today at Eskenazi, all are private rooms, including our emergency department has private rooms. And in this case, obviously, you had more of the ward set up, and this had a lot of this had to do with not only the architecture and the construction and the technology that they had back in those days, but the monitoring of the patients was much easier to do it this way without all the technology we have today. So it was better to actually be able to have more of the ward set up so you can see a patient in distress or whatever it might be. If you look further back in this image, you'll see some murals on the wall. And this is actually the start of our long history of art and healing, which has been part of our hospital system ever since. So in 1914 is when we established kind of the Art of Healing project, which St. Margaret's Hospital Guild started. St. Margaret's Hospital Guild is still around. The hospital, they help fundraise for Eskenazi Health, and they have their show house, decorated show house on Meridian Kessler during this period of time in the spring. Actually, I think tomorrow is when it starts. So St. Margaret's has donated almost $15 million to Eskenazi over the years, including being a big contributor of this art campaign, which included paintings and murals from T.C. Steele and all the Indiana artists at the time. It was a big, Indiana had a lot of artists at that time, and it was a big undertaking for them to do these murals that were placed on the walls of City Hospital. These murals, many of them have survived and are now at Eskenazi Health. including the Four Seasons, the TC steel paintings, which I'll go through, show you later on in the presentation. But these murals still exist. Many of them do, and many of them have been saved and are displayed at Eskenazi Health. Again, here's another example of one of these. This is the pediatric wing at City Hospital. Again, more the layout of the ward type construction so that they can check on the patients easily as the nurses and doctors do their work. And then I wanted to go. This slide is particularly of interest to us. So in the 1920s and 30s, City Hospital there was very few hospitals that cared for African Americans, and we actually City Hospital in the 1920s and 30s was the only hospital that did serve African Americans at that time. It still was not up to what it should have been, and certainly there was a lot of work that still needed to be done. Charles W. Myers on the left here. He was the superintendent of City Hospital in the 1930s, 40s, and early 50s. And he was actually very instrumental in appointing African Americans to the hospital staff. And he also helped champion a lot of the medical advancements at the time and bringing in kind of the current structure of the hospital system. He also helped form the establishment of Health and Hospital Corporation of Marion County, which is the municipal organization that actually owns Eskenazi Health today. They also help run the Marion County Public Health Department. But Charles Myers was very big into ensuring that there was a future financial stability of the hospital system by creating the Health and Hospital Corporation. He also was very big in, as I mentioned, with the bringing more African Americans into the staff, including Dr. Harvey Middleton, who is on the right there, who became one of the first African American physicians in Indiana, and he started his role at City Hospital in 1942. At first, he did have interest in working at City Hospital, and he was only allowed to serve as a volunteer in the outpatient clinic. He then set up his own practice and was a cardiologist, very successful cardiologist in the city, and dealt with heart irregularities, and then ultimately who was brought on staff in 1942 at City Hospital. We now currently have a street on our campus named after Dr. Harvey Middleton. Dr. Harvey Middleton Way is the name of the street, and it brings people into our parking facilities. And I wanted to read this quote that Dr. George Rawls wrote just probably about 5 years ago, well, maybe a little longer ago than that, but 7 or 8 years ago, I guess, is when we dedicated the road, Dr. Harvey Middleton Way. Dr. George Rawls was a very successful physician surgeon here in Indianapolis, practiced at Methodist Hospital. He was also with the IU School of Medicine, and in his later years, he has passed since we dedicated the road. But in his later years, he also helped establish the Rawls Scholarship Initiative and the Rawls Medicine Initiative, which helped bring young individuals, young minorities into medicine. And that in both those the Rawls initiatives are both going today and help give scholarships to young African American med students, and then also help teach and train and educate some of our high school students in medicine. And we actually bring high school students from public schools here in Indianapolis and schools across the city to Eskenazi for training and to learn kind of what it is like to work in medicine, whether it's nursing, being a physician, all the different roles that are in medicine. And Dr. George Rawls wrote, Dr. Harvey Middleton was a trailblazer for future African-American physicians. He opened doors that previously had been closed and had a strong passion for commitment to medicine and innovation. The History of Black Physicians in Indianapolis, 1870 to 1980, is a book that Dr. Rawls wrote and really did a lot of research on African-American physicians, early African-American physicians. So definitely Dr. Rawls and Dr. Middleton have had a big influence on Eskenazi and our history. And then another point I wanted to mention here in this slide, you can see all these pies and that are being cooked. Eskenazi has always, from city to Marion County General Hospital to Wishard, we've always cooked our own food. We've had our own in-house food services here. So meals are all prepared here. We have not outsourced it or anything like that. And that's been a very important initiative for us. We also try to work with local organizations for local, meats and vegetables and things like that to be served in our food service areas. And then just moving along here, as the hospital grew and developed and medicine became more, modern, we also helped develop some of the first things. The first iron lung in the state of Indiana was installed at City Hospital in 1935. And actually, we have a nursing museum, a history museum here at Eskenazi that has, I don't know if it's the original iron lung, but we do have an iron lung in there. But tuberculosis cases were a big problem. Polio, all those things, some of those early diseases that had such an impact on folks. A lot of the medicines and the treatments were developed at City Hospital in the early part of the century. And then in 1943, again, ambulance service continued to be an important aspect of City Hospital, and the two-ray radios were installed at City Hospital ambulances. This was the first we were the first hospital in the nation to use this type of radio communications for ambulance dispatch, and now, of course, it's a common practice. EMS had a lot of firsts in Indiana and in Indianapolis with our ambulance service, and I'll outline some more of that as we move forward in the presentation. And then in 1947, under the leadership of the superintendent, Charles Myers, we changed our name from City Hospital to Indianapolis General Hospital. A lot of this had to do with the outreach of our services, that we could stretch further out than just the downtown area into further areas of Indianapolis. This also set up in 1952 when the Health and Hospital Corporation was established. So this was kind of the ground as movement towards the establishment of Health and Hospital Corporation and the movement to Indianapolis General Hospital. Ultimately, we changed to Marion County General Hospital to include the whole county. As you can see here, the sign going up here right in front of the Ott building. The Ott building still stands. So if you drive down 10th Street, you'll still see some of the old hospital that became Wishard Hospital. The Ott building there at the corner of 10th and Indiana Avenue, as well as the Bryce building, are still both standing. When I first started, I've worked for the hospital system for almost 20 years. It'll be 20 years this Friday, actually, April 25th. My office was in the Ott building there on the third floor of Wishard. So those buildings now are owned by Indiana University. We actually did a land swap in 2010 with Indiana University. We swapped our land that was where Wishard was, and then when Eskenazi was built, we would then move into the new hospital property, which the School of Medicine had owned previously. Here's an image right here of the nursing parlor. This was part of the nursing school that was housed in the Bryce building. And a neat aspect of this, so this is where the nurses, they had their dorms here. They stayed in the building. They had, their library, and they read, and it looks like someone maybe is playing a piano in the background. This area actually was used many years later in 1985 for the filming of the movie Hoosiers. So if you watch the movie Hoosiers, the hospital scenes with Dennis Hopper, the actor, were filmed in this part of the of Wishard Hospital. at the time. They had redone this area and had at that time made it a nursing museum. And then for the filming scenes, I wasn't there for it, but I was told they moved some of the older beds that they had at the time and made it look like a patient room. So it's kind of an interesting fact there. But this is the Bryce building where the nursing school was housed. And then in 1969, General Hospital was designated as by the Indiana State Board of Health as a major trauma center for Indiana. It was also the establishment of Midtown Community Mental Health Center, which is now known as Sandra Eskenazi Mental Health Center. Midtown was and traces its roots to being the first mental health center in the state of Indiana, and we still exist today and treating lots of folks, both inpatient and outpatient. And then our trauma center, this was kind of the start of the major trauma care that we saw and we still see today. We are now a level 1 trauma center. We work very closely with all the various ambulance services and the lifelines, helicopter services to bring patients here for not only trauma, but for our burn care that we also offer. And then in 1975, General Hospital was renamed Wishard Memorial Hospital. And a lot of this had to do with the fact that we wanted to pay tribute to another physician of ours that really paved the way for who we are and what we did as a system, and that's Dr. William Niles Wishard. He served as our superintendent early on from 1879 to 1887, and he really helped the hospital after the Civil War period to develop into a city hospital and a very functioning city hospital. And actually his children, his son later on would practice at City Hospital as well, and Marion County General Hospital. And then in 1975, we named the building after him. Still today, we have we pay a lot of tribute to Dr. Wishard, including a road that's named after him. And then also, as I mentioned, we have a museum here on the campus, which I'll tell you a little bit more about as we wrap up, that also pays tribute to Dr. Wishard as well. His family many of his family members still live in the city, and the Wishard family is certainly very special to not only to us here at Eskenazi, but for the city of Indianapolis as well. And then again, just this is actually outside the Myers building, which was our patient tower at Wishard Hospital. Again, they're just working on changing the name out there as we went through several different name changes over the years. This is an image showing kind of what Wishard looked like right before we closed. So there you can see again the Myers building, and then to the left, the green and bluish windows, that was our emergency department. And then the Regan Street building is past that, which was our outpatient specialty care service building. Then moving into 1992, Wishard Hospital, we became the first verified level 1 trauma center in the state of Indiana. So as a trauma center, we basically are staffed at all times to deal with whatever might happen, from a mass casualty incident to major traumas from car accidents and certain violent incidents. We were able to take care of any of those folks that might come through our door. A lot of it has to also, being a level 1 trauma center, also a lot of it has to do with training that you can provide and the partnerships you have with other EMS services. Wishard and now Eskenazi Hospital is one of 3 level 1 trauma centers in the state of Indiana. Just so happens all of them are located in Indianapolis. IU Health Methodist is also a level 1 trauma center, and so is Ascension St. Vincent on the northwest side is also the newest level 1 trauma center in the state. There are other trauma centers in the state, they're level 2 or 3, but we're the only ones that are level 1 right here in Indianapolis. Riley is also a level 1 pediatric trauma center. And then in 2003, the state-of-the-art Richard M. Fairbanks Burn Center at Wishard opened, replacing the original unit. which was in the Birdsall building. So for many years, basically gradually increasing its services, Wishard and its General Hospital were known for its burn care. And then in 2003, we actually built a new trauma center, a new burn center, I should say, right above our emergency department at Wishard. We have carried this on to the Sidney and Louis Eskenazi Hospital and still have our burn center. It actually has a very similar feel on the blue and the yellow. If you ever go in there, it's kind of the look of our burn center. We have 15 inpatient beds in our burn center, and they're all, of course, they're large, they're private. So because many of the folks that come to our burn center are going to be here for extended periods of time, so it allows for family to have room to stay. We also have areas at the hospital that allow for families to stay overnight if needed. If they're traveling from out of town, we can place them into kind of a special center so they can stay there. It's not in the patient room, but it's in another area, and it has a microwave and nice chairs and a little kitchenette and things like that. So, but burn care is very specialized. We actually operate the only regional burn center in the state of Indiana currently, which is right here at Eskenazi Health. And then Riley has a pediatric burn center, but we have the adult. Again, all are staffed by IU School of Medicine physicians. We have a very strong relationship with the IU School of Medicine, especially when it comes to burn care. And a lot of the physicians that practice at Riley Pediatric Burn Center also see patients at the Eskenazi Burn Center. And then in 2008, as I mentioned, we've been at first in a lot of EMS type services and major milestones in EMS care. And in 2008, the Wishard Ambulance Service became the first provider to be equipped with this new medical electronic medical record technology. And basically, this allowed our paramedics and EMTs to communicate via the medical record with the hospitals to look up information about a patient, determine what type of care would be best for them, to let the EMS could let the emergency department know what's coming in. It really greatly improved a lot of the communication and the care that we can provide to our patients. And then kind of getting into more of the modern era, in 2009 is when the referendum for the new hospital was approved by the voters of Marion County. It received more than 85% voter approval for the referendum. It did not increase the any taxes on Marion County residents, but what it did was it allowed for the bond to go forward so that the hospitals can pay back that money that they had to borrow. And this also showed great support for a new hospital and the need for a new hospital. This picture here was actually taken right in front of Wishard Hospital. It includes our CEO, Dr. Lisa Harris, who's still here, and then the president at the time of Health and Hospital Corporation, Matt Gutwein, and then several members of the Wishard Hospital faculty and staff are right behind there. They are outlining the land swap area on that map, showing kind of the new property that we would take and that we would then give this land to IU. And that happened in 2009. Here's the image of the Indianapolis Star from that day with the voter approval for the new hospital, which was $755 million project, and was on time and on budget. So we were very happy about that. And now we are more than 11 years after the hospital officially opened. And really, it's amazing what the advancements that we've seen with the new hospital, and certainly the benefit it's had on our patients and the community. And then in 2010, this is when Indianapolis EMS was formed, and Wishard Ambulance Service and the Indianapolis Fire Department's ambulance service were combined to form Indianapolis EMS. And since then, Indianapolis EMS has expanded and now includes a lot of the townships as well. and their EMS services. We work very closely with other ambulance services that are outside of Marion County, as well as the Indianapolis Fire Department and all the services that they provide. And then just a breakdown here is some important aspects of the Eskenazi family and what they have contributed to our hospital system. Of course, in 2011, so after we received the referendum support and construction moved forward on the new hospital, the Sidney and Lois Eskenazi contributed $40 million and the naming of the new hospital that ultimately became Sidney and Lois Eskenazi Hospital and Eskenazi Health. Sidney and Lois Eskenazi are they're really a great couple. They are still alive and doing well today. They are in their 80s now, and Sidney Eskenazi came up through real estate and developed Sandora Investments, which is a major real estate firm here in Indiana. A lot of the if you look, the retail malls and a lot of the strip malls have been developed by Sidney Eskenazi, and then his wife is just a true champion and has been along with the ride throughout the years, and has been a big supporter of what we've been doing here at the hospital. And then in 2013 is when the hospital actually opened. We also opened one of our largest outpatient health centers on the west side, Eskenazi Health Center, West 38th Street at 38th and Moeller. And then in 2019, Sandra Eskenazi, which is Sidney and Lois's daughter, she donated $5 million to rename Midtown Community Mental Health Center to Sandra Eskenazi Mental Health Center. Sandy Eskenazi has also been a true champion. She has previously in her career worked as a physician assistant in Denver. She now splits, I believe, her time between Indianapolis and Florida, and is very close with her parents, and has been helping Eskenazi in many ways. Has also been very involved in our EMS service, like I said, in our mental health services, and also our brain care, which includes our dementia care that we provide, and some of our mental health services. And a lot of that has been due to the strong leadership of Sandra Eskenazi and some of the contributions she's made to Eskenazi. And then just some quick images I wanted to show. This is 2013. This is when we were closing Wishard Hospital at the time. And this would have been in a November, December period of that year. We had a big celebration in our Myers Auditorium back at Wishard to announce the gift. And then ultimately right in front, you can see this photo of several folks in front of the Myers building with a big thank you celebrating 154 years of the hospital history. So it was certainly bittersweet to leave Wishard, but we all knew we needed to have a nicer, modern facility that could care for our patients. And then as part of the move, so this would be December 2013, December 8th, actually. That day was very cold. It was very snowy out. And we had a campaign called Go West, which was Wishard to Eskenazi Saturday transfer. And then you can see here, we had 25 ambulances that came from all various ambulance services in the area. We had vans, we had medical transports, wheelchair vans, bariatric ambulances. We had a lot of critical care patients too that we had to bring in, which was could be very difficult to transport them, even if it's just going a few blocks to the west. We also had the National Guard that came in and helped assist us, and it was all hands on deck that day. We were able to get patients moved well ahead of what we thought it would take. The biggest thing, really, the biggest obstacle we had was just closing the emergency department and opening the new emergency department at Eskenazi. And then also, of course, any mothers that were in labor at the time. So it was very special to have kind of the last baby born at Wishard, and then the first baby born at Eskenazi, kind of a neat thing. And as a side note, both my kids were born at Wishard Hospital. So whenever we drive by, where they were born doesn't exist anymore because that building was torn down. but it's kind of a neat history that they can share as they grow up, that they were born at Wishard. And then here, this is actually this shows kind of the front of the hospital on 10th Street. This was during our celebration to kind of the opening of the hospital, which it was not the official opening. It was more of a media event and letting the public know that we were going to be opening. It was November of that year, and we had a big tent. The weather was much better for this event than it was for the actual move. But you can see the tent set up there. And then in the far left corner is an older building that's no longer there. It was a site building that IU had owned, and that building had to stay for a little while. But then we've torn that down now and built a lot of nice landscaping that's been put in there, women's garden. We have our common ground area, which includes our Fresh View Market, and other areas that I will go through in just a minute as well. Here's an image of Dr. Harris, our CEO, locking the doors for the last time there at Wishard Hospital. I believe this was the Bryce building that she was locking up as we closed up the building on that December 8th, 2013. Again, another view just from the showing from the east to the west. This is you can see right in front is the Ball Gardens, which is on the IU campus. And then on to Eskenazi, the patient tower, and then the outpatient building, and then our the Fifth Third Bank building, faculty building, right there. Eskenazi, the Sidney and Lois Eskenazi Hospital includes 21 ORs. So this is one of our OR suites that we have at the hospital. So we do lots of surgery. We also make sure that we have OR space for any traumas that come in, because we are a level 1 trauma center. So we always have to have emergency space for surgeries if needed. We have, not only do we have our OR suite, but we also have 2 ORs in labor and delivery area for any C-sections, and then also we have 2 ORs in our burn unit too. Again, more images of the hospital and our patient tower. Here is an example of one of our inpatient rooms at the hospital, the current hospital. All our patient rooms, we have 333 staffed rooms, and they are all private rooms, which at Wishard was not the case. Many of our rooms had two patients in the room. This really became a very critical point during the COVID pandemic. We had moved to the new hospital by then. So to have the new hospital and the modern efficiencies of it, the airflow, all the things that we needed during COVID really helped us be able to treat patients during that difficult time. And I think many of us could not imagine having to do that at the old hospital. Again, this is our main concourse at the hospital. Today we treat more than 1 million outpatient visits each year. This includes not only at our downtown campus, but also at all our outpatient facilities. We have 14 outpatient facilities known as Eskenazi Health Center locations throughout Indianapolis. We also provide lots of other important services. I mentioned our burn center. We also provide lots of specialty care services. Last year alone, we had nearly 170,000 outpatient services, 437,000 outpatient primary care patient visits we had, and then over 100,000 patients to our emergency department, and nearly 380,000 mental health patient visits. So those aren't necessarily independent patients, but they're the patient visits. So it could include multiple patients that come to a visit. And then another emphasis, I know I mentioned earlier the importance of art over the many years of our hospital and our history of our hospital, including the Art of Healing, which was part of the St. Margaret's campaign in the early 1900s. We continued that when we built the new hospital. when Eskenazi Health was established, we put a lot of emphasis into art and the establishment of an art program. We actually we did a campaign, went to City Market, went out to the community to encourage local artists to be part of our campaign, and also to have funders contribute to the art campaign. And we also stressed that we wanted to make sure that the artists that we had that were selected represented Indiana in all sorts of ways. So if you look here, almost 60% of the artists that we selected were from Indiana. Almost half were minority. 31.5% were women, veteran-owned 10.5%, and disabled 5.2%. And also we had 5.2% of our artists were seniors. So it was very important to make sure that we had a good reflection. And in this image, you can see right in front of you this like roller coaster ladder. This is called Paths Cross. And it was put in actually during our construction of the hospital. As you can imagine, it was very difficult to have installed, and still stays there today. And then the other paintings you can see them in this image. They're hanging one of our murals from the old hospital. This is one of the Four Seasons paintings that TC Steele painted. It's in our conference center. And then we also tried to make sure we had interactive art, and then art that reflected Indiana. So including native trees to Indiana. Again, here are some more of our some more of the art that was part of the original 19 art. They weren't 19 individual pieces; they were 19 artists. So some of the artists contributed multiple pieces. This painting was actually, this is a local painter that put this painting together. And this piece of work is really nice. It's in our surgery area, and again, a local artist did this mural or painting. And then here is the Four Seasons in our conference center. So we have winter, spring, summer, and fall. These all came back early on when we moved to the new hospital. One of them was actually at the State Museum. I believe it was the winter painting. It had been on display there for many years. And then when we built the hospital, we worked with them to make sure we got them back. And so they're all now on display at the hospital. And then if you have a chance to visit Eskenazi, certainly take a walk and see some of the things that we have, some of the art we have displayed. Also, we have a sky farm that is currently closed. I'll talk a little bit more about that in a minute. And then in our lower level of the Fifth Third Bank building, there is a history area, which includes a lot of the exhibits that were at our old nursing museum, which was at Wishard. When we closed Wishard, we brought those over to the new hospital, and those are displayed in a nice area for folks to come and look at. We also have a legacy art tour that is also near the history display that includes a lot of the paintings that were at City Hospital. And then again, another one of our art pieces that's actually outside on our parking garage. This was, if you ever see this when you drive by, based on the sunlight and the direction and all those things, this art piece can look very different based on how you see it. So, and then as I mentioned, this is we tried to get a lot of artists that this art piece actually is an interactive piece. Was created by students at Ball State. There's a little camera in there, and it senses your movement, and then the light will change based on that. And again, some more art that we had throughout the hospital. Music has also been another important aspect of the new hospital environment. So not only art in the sense of paintings and the visual arts, but music. And so we have a program called the Marion Tobias Music Program. We have concerts every Wednesday, and then we also have some concerts other times as well. And then we have a grand piano that is in our lobby that anyone can come and play. We keep it covered just to keep it safe, but anyone is welcome to take that cover off. And if there's no concert going, they are free to play and enjoy the music and enjoy playing the piano. We also have a piano at our new Thomas and Arlene Grandy location on the east side as well. And then again, just showing kind of some of the art, music concerts we've had over the years, including individuals. In the center is a patient just playing the piano, and then the upper right is a physician that's playing the piano. So anybody is welcome to play whenever they want. So, and then another aspect that we tried to really, based on feedback from the community, feedback from staff, was to just create more natural environments in the hospital. If you had ever been to Wishard Hospital, it was built over many years, and it was kind of a maze, a collection of buildings. We wanted to try to have an opportunity to really build everything at once with the new hospital, and also have lots of windows, lots of trees surrounding it. We also have places like this in the middle that has pop-up little gardens that people can see, and so you're always going to be around light, natural light, um, growing spaces, all those things were very important when they built the hospital. Another aspect that we tried to emphasize too was that, if we do need to build and expand the hospital, that we're able to do that in a good way, in a way that makes sense. And the hospital is built for that. So if we ever do have a need, and we have more patients than we can care for in our current facility, we can build outward towards 10th Street, and build another patient tower. So, and as if anybody that knows how healthcare has gone in the last 5 years knows that healthcare is being taxed more than ever. More people are needing care. We're still seeing lots of inpatients. For a while, it looked like more services were going to be on the outpatient basis, but because I think COVID and some other things, it created more of that need. So we definitely have the potential, if we need to expand down the road. And then this is one of our labor and delivery rooms at the hospital. Teaching areas are very important. So this is a group of physicians that are going over charts, and you can see the white walls and all those things that are a part of just the aspect of a teaching hospital. I mentioned history being an important aspect of who we are and what, and just wanting to make sure we don't forget about our history. So at the hospital, we have a history area, display area that is free, and certainly you're able to come and look at if you would like. That displays a lot of our history of the hospital, and including the iron lung and some other things, and pictures of some of our former physicians. And they have an outline of kind of the wardrobe that nurses over the years. So it's kind of a neat thing to check out. I also mentioned our Sky Farm, and you may have heard about that. We have a Sky Farm on our roof. It's currently getting worked on. It's under construction, so it's closed. But this is what it looks like. It's going through some remodeling, and part of it has to do with the fact that it had been 10 years, and when you have that much growing on your roof and that much soil on there, it does create a load. So they have had to go in and kind of make sure that there's no issues, and that the no leaks and things like that. But when it does open, it will be again open for the public. We're hoping this summer, and it's free to come, and it's a great space. It's great to look at the downtown. We actually were there during the eclipse last year, and that's where I saw the eclipse from. It's a really nice space. We also were able to bring some of our patients that were able to at the time to come up and watch the eclipse from the roof. They do that on a regular basis, is bring patients that are able to come out. We found that being out in nature, being out in the fresh air really does help with the recovery process. Again, more spaces. This is a view from our common ground. These are some kids that were playing in the water from the daycare that's on IU campus. They brought them over one day, and we snapped this photo. But it's not unusual for them to come by and at least walk around and see what's going on. Again, I think making sure, just stressing that we have been, our history traces back 165 years, from City Hospital to Marion County General Hospital, to Wishard Hospital, and to Eskenazi. And I think that just shows the importance that we have for our community. It's also been, we've really tried to embrace being out there in the community. So not only being a hospital space, but being at health fairs and having our health centers that are can serve the community. This is some images of the Eskenazi Health Center, West 38th Street. This was actually an old electronics store Circuit City, I believe, that we turned in and refurbished into a healthcare space, to a health center. And it's a great space. This here in 2024, we opened the Thomas and Arlene Grande campus. And this is on the northeast side of town at 38th and Arlington. It is by far our largest outpatient building that we have. It includes imaging services, physical therapy, Marion County Public Health Department spaces, the WIC offices, the Babe Store, dental, pharmacy, physical therapy, and then all the primary care services as well. So it's a great facility. And again, we work very hard to get the community's input on the facility and bring in our neighbors. A lot of our health centers, we employ the folks that live in those communities. They know the communities the best, and they know the individuals that live in the community. So I think that's been a great aspect of Eskenazi and who we are. And then here, this just shows the outline of our whole system as a whole, with the hospital being the anchor, and then the health centers that surround it, including our mental health services. We try to do a lot of community engagements. So not only going to health fairs, but having the community invited to Eskenazi and come to our common ground, or come to the farmers market, or any type of events that we might be having on our campus has been extremely important for us. This image here that shows the common ground in the top left corner, in the middle of that is the Fresh For You Market. It's a market for our patients and visitors. And we also are able to give coupons to patients to use at the market. We also take SNAP and other benefits too for patients to utilize and get their foods from those services. And then we have a bus too, a Fresh For You Market on wheels, that you may see out in the community that goes to various health centers and various locations for our patients as well. Our mission continues to be to advocate, care, teach, and serve, with a special emphasis on the vulnerable populations of Marion County. This has been our mission for many, many years. We really emphasize enhancing our ability to meet the needs of the underserved in Marion County. So Eskenazi Health, we're not only a public municipal county hospital, but we're also a safety net hospital. So we get a lot of individuals that don't have any other place to go that can get services at Eskenazi Health. But we also serve a lot of other patients that, are commercially insured, that, have the means. And I think that both those mix really help us, because we need to have, for us to be sustained, we need to have a good mix of patients. And that's the overview of kind of the history of Eskenazi and who we are and what we've done. And I think, looking forward into the future, we are studying and examining all that may be happening as far as healthcare in our country, and, how we can sustain and be there for the next 165 years in the future. And always looking at ways that we can better serve the community, whether it's building another health center that is in an area that needs care, or making advancements at our current hospital. We're always looking at ways to serve the community in the best way possible. So, but I do appreciate you listening and hearing what I had to say. But I would love to, if you have any comments or questions, I'd be happy to answer those as well.
Thanks, Todd, for the presentation, and to everyone for participating. If you're registered to attend today's online lecture, you'll receive an email from me next week with the link to the recording. So thank you, everyone, for taking time out of your evening to join us.